Hello, dear friends. My name is Turan Fedai. I have many years of experience working in health system management and organization. I have recently developed an interest in software, and I had the check to look into Health Cloud, which Salesforce presents as significant solution for the complexity of healthcare. I want to impart to you my expertise. Firstly, in order to comprehend the structure of Salesforce Health Cloud, Let to take a look at the general framework of the health system. When someone is ill or injured, they go to the hospital first, where they primarily interact with medical professionals and receive services. The payment for healthcare services is covered by either social security institution or private health insurance. If insurance is unable to cover the cost, payment must be made out of pocket. Certain medical supplies, equipment, and medication may be used during this services installation that are determined by medical professions. These distinct but actually significant industries function within the health service system. In addition to all of above, preventive medical health services are a critical component of the system that safeguards overall health. Salesforce Health Cloud was developed to automate process and provide additional capacities by using the data and information proceed within the existing system. Yes. We will understand Salesforce Health Cloud better when we understand the general structure of the healthcare system and its change and transformation over time. To better understand the need for such automation, we will first examine how healthcare services have changed and transformed. Furthermore, how the change and transformation are reflected in the shape of the data model. We will observe how ideas like care plans, care programs, utilization management are automated through this transition. In addition to some extra advantage offered by add-on packages, Experience Cloud will allow us to observe how data is presented to various groups. In conclusion, we will look at Salesforce Health Cloud advantage and make some judgments regarding the program. Looking at the evolution of the health system and health services, we can see that in the 1900s, a town doctor could perform nearly all medical procedures, including minor surgical procedures, with just a small doctor box in his hand. However, today, due to the change and transformation that has occurred over the course of a century, these procedures can be performed in expensive complexes where each branch has its own hospital buildings. When we look at how this change and transformation have come to this point, we see that the health services are provided within institutions that are both technology and labor intensive. We see that the number of medical devices, which was around 100,000 in the 1970s, has reached 2 million today, which is a very important figure. Therefore, this has become a very separate and independent sector. In terms of staff diversity, in the early 1900s, there were only 5 staff treating cardiac disease, but within 30 years, this number of staff had increased 32. Today, we see that more than 1,000 are working, 1,000 titles are working our hospitals, and perhaps more than 100 branches are involved in the treatment of heart patients. With more than 2 million medical devices and hundreds of medical personnel involved in disease processes, Of course, as you can imagine, there are some difficulties in coordination. This leads to an increase in share of the country's GDP spent on health services, especially in developed countries. We see that the share of GDPs allocated to health is almost 20%. In most countries, this figure is around 50-10, or 50-10%. At this point, distinctive features of health service, which can be defined as the unpredictability of who will get sick, draws attention. We observe that 20% of population doesn't use any of resources allocated to health, whereas 5% of population uses 50% of the resources. It is not clear who will be in the 5% and when. In other words, if you are a healthy person today, tomorrow you may fall in this 5% and use resources far above your budget. This significant risk makes health insurance a necessity. The huge amounts of resources allocated to health have led to significant pressures from health insurers on hospitals to strike a balance between cost and patient expectations. Therefore, these pressures brought up concepts such as the search for less cost, better quality service, and the need for effective management and organization in hospitals until the 1980s. This led to introduction of concepts such as organization and management, effectiveness and efficiency, accreditation, performance management, leadership, accountability, which were not on the agenda in the health sector under them, and the introduction of practices such as care plans, care programs, utilization management in support of this concept. We see a structure where concepts such as care plans, care programs, and utilization management late 1980s and were applied manually, have been automated since 2015 with Salesforce Health Cloud. Now, in this part of our presentation, we will continue with a structure that examines how Salesforce Health Cloud responds to the change and transformation in healthcare services, both the old version and the Health Cloud application together. First of all, we will look at the data model, care plan, care program, and utilization management titles. We will review the additional packages. We will take a look at the experience cloud. And finally, we will focus on application outcome examples. First, we will look at the data model. First of all, it is useful to start by answering one of the frequently asked questions. What is the difference between Salesforce Health Cloud and the patient records given different ways since 2500 before Christ? What will we gain? Why electronic patient records are hospital and clinical centered, compliance with legal regulations, and mainly clinical decision support system that supports practical decision making. When we integrate them into Health Cloud, it makes the structured patient-centered and patient participation in the treatment process is ensured. Again, as an important feature, we became able to use the CRM capacity as Salesforce. The accessibility of patient data expressed as interoperability between institutions and on different devices within the framework of authorization, automation of care coordination, utilization management, analysis and prediction, customization, and interaction are most important advantages. If we see this in a little more detail on another figure, as a result of integration of existing electronic patient records with help of the MuleSoft program, we gain the features and CRM capacities that we can use with Sales and Service Cloud and Marketing Cloud with health system. In addition, we see the hospitals, payment institution, and pharmaceuticals and medical device institution that we see within the health system can see this information on a number of screens as they need it within different data model. And that this data can be used in a number of activities such as utilization and referral management, integrated care coordination, social determinants of health and home health, etc. Within intelligence application, we can see the utilization management, hospital data analysis, patient can be followed in different groups, and medical device analysis can be done very easily. And within the experience cloud application, different data can be displayed on different screens to the different community. The general view of patient-centered data structure or over Salesforce Health Cloud is as follows. Here you see that the patient's address information, the patient's condition, medication, allergies, insurance plan, and other information you desire are also visible on the patient card. Again, we can easily follow the patient account information and social determination here. We can easily integrate the patient into the care program. We will create within the button running flows behind them. We can request and create a number of medical devices that we want to give to the patients with the help of buttons here. The timeline of the patient, test and the patient's household appear in a very easily accessible structure on the drop-down pages under the tabs. We will look at the details one by one. After a brief look at the data model, let's talk about the care plan. As I mentioned, Salesforce Health Cloud was launched in 2025, but with the change and transformation in healthcare system, care plans have been implemented in hospitals in terms of process management since the 1980s. In a 1995 study, 81% of hospitals were using care plans to monitor and manage clinical processes. Therefore, we can define care plans as a sequencing and timing of procedures related to scientific specific diseases in order to use resources more efficiently, improve the quality of care, and minimize delays in the care process. When we look at the classical care plan developed for stroke patients, we can see that all procedures such as admission and discharge criteria, tests to be performed, treatments to be administered, medications to be given, issues related to education of patient and his family were planned day by day. Plans were created in this way, and some forms had to be developed for their follow-up. When we look at the main features of care plans, covering everything that needs to be done in the treatment process, that their times are specified, plans are both developed and implemented within the cooperation of doctors, nurses, and other health personnel involved in the care process, and the follow-up to plan by case manager is also a necessary criterion for the success of the plan. If the plans are successfully developed and implemented, we see a number of success results in the literature. In particular, the length of hospitalization of patients, which is one of the important criteria of efficiency and effectiveness, has decreased significantly. For example, in our study, we found that hospitalization period could be reduced from 8 days to 7 days with the planning we applied on stroke patients. Therefore, the expected outcomes of treatment planning can be summarized as a reduction in the length of stay, a significant improvement in the resources used, improvement in quality indicators, and an increase in the satisfaction rates of patients and staff. Therefore, care plans can help to meet a number of expectations arising from the change and transformation in health services, in particular, reduce variability in the treatment process and outcomes. This topic is very important, but the analysis of variability in care planning is not included in Salesforce Health, or we did not see it. In our study, we also investigated the reasons for the emergence of a number of practices different from the planning. For example, factors related to patient and family, factors related to healthcare, personal and system-related factors. When we grouped them into 11 factors and determined the most important factors by Pareto analysis according to frequency distribution, we determined that the length of hospitalization for patients could be reduced by 1.27 days by eliminating the first 5 reasons. In other words, while the length of hospitalization can be reduced by 1 day by planning the treatment processes, an involvement of 1.27 days can be achieved by controlling these variables. For stroke patients, 1 day is equivalent to $1,000. When we looked at what these problems were, we found that there were problems related with the transfer to other clinics, social reasons related to patients, delays in the transfer to rehabilitation centers, late examinations, and consultants, physicians delayed. How has this been addressed in care plans in the Salesforce Health Cloud? Since 2015, a structure that aims to automate the current practice and achieve similar results in terms of productivity, treatment result, and costs has also been seen here. In Health Cloud, care plan templates are created primarily for specific disease. First of all, a defined health problem is addressed. Some targeted outcomes are presented to overcome this health problem, and some tasks to be performed by patient and health personnel in order to achieve these goals are presented. These are given in conjunction with each other. When we look at the patient record, first of all, a diabetes care plan template is created, for example. Templates can be defined as average plan structures that can be applied to each patient. It's not necessary to apply the same plan exactly the same way for each patient. If some patients don't have some of these template-related problems, they may not be marked or may be added. For example, common problem titles in diabetes care templates, high blood sugar, sedentary lifestyle, lack of diabetes self-care awareness, and lab work. The goal to be achieved in relation to the high blood sugar problem is control glucose level. In order to achieve this goal, the two tasks given the healthcare staff and the patients are order labs and self-care daily glucose self-check. Likewise, another program titled Lack of Disease Diabetes Self-Care Awareness. The target is diabetes self-care. The tasks are scheduled education for staff and exercises for patient, daily work for the patient. We see that these tasks are also processed day by day on the patient timeline, day by day, and that they can be monitored on a structure that can be followed by both the patient and the staff. If you remember, in the classical care plan created for stroke patients, we also saw that charts were created to follow this structure day by day. Here too is automated. In the patient's care plan, under the care team tab, we can also see the staff in charge of the plan within the patient-centered structure. Patient and his diabetes education, Adam, care coordinator, Dania, and primary care physician, Marta. In the same way, we can see and communicate with these people collectively on the household page. As they were the patient household, as well as patient himself and patient support. After discussing care plans in detail in this way, let's look at the care program as another main heading. Care programs are actually handled with a similar structure to care plans, but the purpose is slightly different. In 1900, patients were the recipients of medical care, whereas today, the patient has become a partner in his or her own care processes. To this end, Health Cloud has developed a set of tools to help patients engage in their own health process by providing education, by providing access to documentation and resources, by establishing follow-up procedures to monitor the patient's progress through the process, with organizing financial support and aid, sending a number of reminders via mobile devices, and a number of analytic tools have developed programs to help patients engage in their own care processes by predicting the risk of patient compliance with these care plans. Under the care plan heading, we saw the diabetes care plan. Here, we see the structure where patients are enrolled in the care program to ensure their participation in the system for the management of disease. With the help of a button, on the patient page and flow running in the back, we can enroll the patients to a program we design very quickly to the incoming page. Next and next. Like this. When we look at the resulting patient report, the purpose of care program makes the difference between care plans a little more apparent. Here, rather than goals related to acute treatment, there are some goals related to improvement the general life standard and ensuring the patient's participation in his or her own care program, such as adhering to treatment protocols, maintaining the health lifestyle, exercising for 30 minutes each day, and improving quality health life. Of course, the fact that the patient has type 2 diabetes is a criterion for admission to this program. In addition to this, the low income level of the patient's family was also considered an important criterion for admission to this program. We understand that a structure that takes into account that low income family members have some difficulties adapting to some care programs has been developed here. Again, integrated into this structure, we see that reports that take into account the social determinants of the patient are also created and automated here. In order to eliminate the patient's transportation obstacles, the patient is called from transportation, and a public transportation vehicle is allocated to him or her. Having also see that the patient's consent is obtained by electronic signature for enrollment in the program for diabetes management. Having seen how patient's treatment process is planned and how the patient's participation in the process is ensured under the care plan and care programs heading, we will now see how utilization management is handled to prevent unnecessary use. Here, learning about one of the unique features of healthcare service will help us understand the subject. We define this with the concept of information asymmetry in healthcare. When we look at the health demands of patients, according to study conducted in 2000s, patients who consult a doctor and express their illness constitute only 38 of real patients. We see that a significant portion of the population, around 62, doesn't express their health needs. We can think of these patients as needs in terms of Salesforce. We see that doctor decides on the treatment processes of people who express their illness. This decision may often differ from the patient's expectation. In other words, the doctor decides what our health needs are. Unfortunately, the doctor's decision is not always rational. Therefore, unnecessary use of beds, medication tests, and outpatient clinic may occur in hospitals. The doctor's decision also needs to be audited and evaluated at the same point. Therefore, unnecessary utilization brings us the concept of utilization management, especially for payment institutions. Payment institutions evaluate the necessity of the health service requested by physicians for the patient and can say that some are appropriate or some are not. If it is appropriate, pay yes. If don't appropriate, pay don't. The Health Cloud automates utilization management application that is from the doctor assessing to and determining the need on our behalf to the insurance institution accepting and paying for the determined need. The goal is to ensure that the right care and right time and right duration and in the right environment. For example, a request form created for a patient, when we look at it step by step, health personnel can request the health services that they will provide to the patients through a number of automated forms and buttons. Insurance institutions can also evaluate the requests they receive, though their screens both in general and a patient basis and approve these requests. After covering health laws, data model, care plans, and programs and utilization management in details, I would like to briefly mention the features provided with optional add-on packages. There are many features as Omni Studio, Einstein Analytics for Health Cloud, emergency response management, and etc. Health Cloud reports for patient referral management as optional add-on packages. I was only able to review Einstein Analytics due to the time constraint. When we look at the content of Einstein Analytics, we see that a number of detailed statistical analyses and graphs can be made regarding care plans, utilization management, and referrals to hospitals. These programs also created these analyses with the help of Tableau. For example, that patients can be classified according to their age group, medical conditions, and hospital admission status. We see that the care plans of patients, especially those at risk, can be tracked and tests assigned in different ways also be tracked. We see that payers can track on graphs which hospitals and how many requests for care plans have been received and how many of these can have been rejected or accepted. So after a quick overview of additional packages, let's take a look at the benefits associated with Experience Cloud. When we exit the Health Cloud with digital experience, we encountered the Health Cloud app template. We have the opportunity to create custom web pages for all partner community which mentioned while summarizing the health system and provide them with access to data they need. Without any customization, we see that the task we have created about the patients here can be seen by the patient of the coordinators responsible for the follow-up of the patient on the timeline. The patient can be enrolled in care plans, or the number of cases can be opened. About them, again, we see that the patient appointments can be made from here. We can also check whether the assigned tasks are being followed up one by one. The example of the structured patient portal used by a hospital can help us understand what can be done. Here we can see that patients can access number of forms, be trained with a number of videos, and make appointments. Finally, we investigate the benefits of Health Cloud application. It was stated that the integration with MuleSoft between the two clinics resulted in the 70% increase in overall management, improved data storing and management, improved appointment management, increased real-time data management, and a mobile version is available. Again, with another Health Cloud implementation, we see an improvement from 45% to 65% in patients reaching the expected level of recovery in the expected time, and a 70% reduction in manual process to remind patients of upcoming events, an 85% reduction in the email creation process, and with a 40% reduction in total cost. In the same source, we see that with the Health Cloud application, it is stated that operations costs are reduced and application deployment faster and the faster response to stakeholders. Of course, these benefits come at a significant cost. Health Cloud license costs are a bit high as they see in the reflection. Despite being so expensive, we see in the demand forecast that there will be an annual increase of 23 in the market share. That an increase in this market share of $42 billion is expected in next 5 years, and that 39% of the world market share is in United States. What we look at the critical success factors for Health Cloud implementation, why United States, for example, compliance of health system and payment system, effectiveness and efficient phase management approach, participation and support of physicians, education and communication and change management is important. In particular, the relevance of health and payment system is most important factor. In order to better evaluate health payment system, I recommend Michael Moore's documentary film, Siko. Thank you very much for listening to me patiently. I wish you all a good day.